Hi, benchwarmers. Welcome to episode number 2.
Welcome. Jeez, that was cheery, Hannah. That was cheery.
Feeling confident.
You should definitely do it every time.
Feeling super confident.
Hello, benchwarmers. No, I love it.
We're still running with the name.
Yes.
We are.
I like it, but
It's kind of cute.
But you know, this is our second episode, and
And we're definitely filming it not after our
not
first one.
straight after. No, definitely not. But you know, I live in Toowoomba, you live in Brisbane, so logistically, we just thought it'd be better.
Yeah.
But yeah, just use your imagination. Just use your imagination.
We're wearing different clothes.
Woo. Yeah. Weekly podcast.
So on today's episode,
Yes.
we are going to talk about our uni experiences.
Yeah, well, I think you were definitely saying we wanted to put this towards the general population, but we also thought, you know, going through uni ourselves, having a podcast that talked a bit about physio and what it was like and stuff would have been nice. So we definitely wanted to talk about our own uni experiences and stuff like that. But yeah, I mean...
we both have really different... We kind of touched on it last ep anyway.
Yeah.
But we both have really different... uni
Journeys.
experiences, like how we did it. Like we went to obviously different unis, but then our way of becoming physios is pretty different.
Yeah.
So where did you go to uni?
Well, like I said in the last episode, like I did my bachelor's in the States, which I ended up with applied science with a major in biology and kinesiology, which is like the exercise science. And then I got into the master's program in UQ for physiotherapy studies, master's program.
What was the physio program at UQ like? Like, what did you do? Like, did you do much theory? Like, what was your placements like?
Wow, those are big questions. Since it was the master's, it was really condensed into 2 years. We had summer semester and all that as well. I actually quite liked it. We had a small cohort of 40 or 45, I think. But it was very condensed and a lot of content. But predominantly we had 4 or 5 placements. I think we only had 4 placements. Where did you have 5?
We had 5.
Yeah.
So we had 5-week placements. So basically you'll last from like halfway through 3rd year till halfway through 4th year is all placements. Yeah. And then we've got like a 6-month where you can work on your like honours project. So I did the 4-year program at CQ. So ended up with a bachelor's of physio with honours. And yeah, so basically it was 2.5 years of theory, and then 1 year of placement, and then a year of thesis, basically.
Yeah.
So it was,
yeah. We did like an observational placement as well.
Yeah,
where
we did a bunch of those as well.
Just shadowed people.
Just looked at people.
Yeah. Had some some of my classmates had some interesting ones for that one.
Yeah.
Because it didn't actually have to be one that UQ approved of. You could just source your own. And I think usually with other placements you could source your own, but you'd have to go down a really quite a big of a channel. They have to do certain paperwork and blah blah blah. Whereas the observational, they were just, oh yeah, that's a physio clinic. You can go do observation, because all you're doing is observing. You're just shadowing kind of thing. Yeah. And one of my classmates had a physio that did Reiki.
No.
Yeah.
No.
Yeah.
No.
I mean, this is only opinion of Reiki, but it's a bit voodoo, you know.
It's my opinion as well. We have the same opinion.
She was just like, all he was doing was like going over the auras of people and whatnot. So.
That just reminded me, I know not funny stories, but funny story. I had a student sit in with me. So I get terrified when I have students sitting in with me because I don't know, what if they see something that I do that I don't know that I'm doing? Anyway, basically I had this student sit in with me and obsessed with like dry needling. And so I remember that I mentioned, I was like, oh, this person likes to get some dry needling. I'm going to do some dry needling. And it was for their lumbar spine. This is a young girl. Like, she's like 20. And the student who's sitting with me is like maybe a 20-year-old guy. Yeah. Anyway, and so like when we're like doing the dry needling, we're like, you know, you have your hands on like different anatomical structures and like you're lining things up and, you know, you're ready propping in. And as I'm about to put this, you know, needle in this client's lower back, I see this guy come in like this far away from this girl's back, just staring at it. And I was like, this is so weird, but like, okay, like he's not doing anything wrong. She's face down, so it's a bit weird. Put the needle in.
Does he faint?
No, it gets so much worse.
Oh, okay.
He like watches it. I put the needle in. It's like, okay, cool. And then he like starts getting a nosebleed.
Yeah, yeah.
Right?
Oh, what?
Yeah. So I was like, oh, don't worry. Like you like just, you're right. There's some tissues up there. Just go outside.
Yeah.
I'm still in treatment with this lady. And I'm, again, distracted, like go around, like wiping different areas down. And I look up again, and this kid has shoved these tissues up his nose to stop the nosebleed, but he's still in the room, and he's still like this far away from this girl's back. I ended up having to ask him to leave the room because it was just the most awkward. Like, and he was just like, it wasn't like he just like, it wasn't like he just like put a little bit up.
Blood on her.
He literally was just like, but he like shoved it up and then was like emptying the tissues in the tissue box and putting more up there.
Oh, wow.
It was pretty wild.
It's like a she's a man moment kind of thing.
That's exactly what I was.
Should have given him a
like,
tampon.
I should have given him some tampons from the bag, but no, it was really weird. Really weird. That's my weirdest student experience. And he came through, CQU. I don't know if he was a first year.
You have students come through your clinic?
Yeah, I've had a few. I've actually had quite a few. Not my current clinic, but my old clinic. I've had so many students, which is like being like second year.
And you had like students already.
Being second year out was actually terrifying having students, like just for observational stuff.
That's crazy.
But yeah, it was a bit weird.
Oh, just for observational.
Just for observational. Oh god, no, I was not an educator.
What? Because like when we go through uni, through placement. Sorry, not uni. You got your cardio placement, your musk placement, your neuro placement.
Yep. We also had ortho.
You had an ortho placement. Wouldn't that just be musk?
Nah, it was like post knees, post hips in hospital.
Enough. Yeah.
Musk, most of our musk, they tried to give us like private practice.
Yep.
But some people would go to like an outpatient in the hospital.
Yeah, that's what I had. Yeah.
And then we would have whatever else we wanted to do, like one of whatever we wanted to do. Yeah, which is theoretically.
I can't remember what I put as my elective, but I ended up getting like community, which was the low-key the easiest.
Yeah, I was gonna say community. I feel like the community placement's always a bit cruisy.
For people that don't know, community is pretty much just
drive around.
Yeah, older geriatric people doing little exercises with them in their homes and giving them a bit of massage. Pretty much, that's all. That's all you're doing.
Yeah, it's not crazy.
It's pretty much rinse and repeat. quite a lot. To be fair, that's what a lot of people have told me about ortho though.
I didn't like ortho. Like the ortho placement that I had, I didn't love it. I found it really quite boring. Like it was just repetitive. It is
so repetitive.
It was like here's
knee replacement. Oh, another knee replacement.
Oh, we've got to get to 90 degrees before you go home. That's day 2. Out you go. It was just
here's $100,000 a year.
Yeah, that's exactly right. That's exactly right. I didn't love it.
It's not very stimulating, I think.
Nah, I just felt like it was just like, okay, like you have your safety parameters of blood pressure and things like that you obviously work with them, but as long as they're all good, it's like, and then it was like, okay, their blood pressure's not good, so let's make it good and then do the same thing anyway. So it was just a bit like, I didn't love my ortho placement. I think it was probably my least favorite placement. I just found it, I didn't hate it, I just found it boring. Yeah. I did enjoy it. But ortho in private practice is different. Do you get much ortho in your private practice?
Yeah, we get a lot of referrals, obviously post them being in the hospital. But yeah, they can be good. Yeah, for sure.
I feel like that's a lot more fun than.
Yeah, it is. Yeah, it is. I find knee replacements fun because you really
you just push them.
I just push them. Yeah.
Sorry, mate, because I know it hurts, but keep going.
I've definitely been told I'm a bit of a sadist when it comes to. Have you been told you're sadist?
But like it's a knee replacement. Push it.
Yeah, push it. Yeah, it is. Yeah.
I always feel
it hurts.
Yeah, that's too bad.
I don't care.
That's
you
it.
Get that right. It's like take a breath. It's gonna hurt. Breathe out.
I feel like half the time people come in with like these knee replacements and they like genuinely think it. They don't realize how big of a surgery it is, and then they genuinely don't think it's gonna hurt after. And you're like, bruh,
yeah.
Nah.
And you're like, I got it to fix me. Why is it in pain?
So
I'm like, mate. Also, I've had clients that I'm like, why are you taking pain medications? And you're like, it doesn't hurt. It doesn't hurt. And then I'm pushing. And we're like, does it hurt? It hurts now. It hurts now. Take your bloody pain medication. Anyways, sorry, that's a bit of a tangent,
It's
isn't
so
it?
funny though.
Yeah.
What was your favourite placement?
My favourite one, oh gosh, I would say actually my Musk placement was, and it was outpatient at MARTA.
In Brazil.
Was it private or public? I think it was public. They had an outpatient, and only because the physios that looked after us there were really cool.
Yeah,
really
cool
about it. And this was also like my last placement, and so I was pretty well versed.
Done. Yeah.
Whereas my first placement was neuro.
Oh,
up
that's
in a
rough.
hospital.
That's rough.
And I barely passed.
That's rough.
Like, she was going to fail me for that placement. I was very skin in my teeth. But that's just your first placement, you know? So I was really happy I got past it.
Yeah.
But, oh my gosh, that was rough. Yeah.
That's a really rough first placement.
The thing is, I went into disability afterwards.
It's so funny.
I actually find neuro very interesting.
Yeah, neuro is interesting.
It is very interesting. But yeah, that was my scariest placement as well.
So my first placement was at was cardio resp.
Yep.
Which I also was terrified for.
Yep.
But it was at Caboolture.
Oh yeah.
Which is like wild. It was pretty interesting.
Yeah.
It was pretty interesting. I didn't because I was a student, but we definitely had a few inmates.
Crazy.
Come through. So it was like you'd see these people walking down the corridors like with two cops either side of them and handcuffed to the beds, and it was a bit rough.
Mate, I've had a couple of physio mates work at Logan.
Yep.
Yeah. I've actually had a few nurses as well.
Yeah.
That work at Logan. Like, patients taking a shit in their hand and throwing it at them and things like this. And I'm like, wow.
I've never had that happen, but you see some stuff in hospital.
Yeah.
You smell some smells in hospital.
I mean, that's why it's practically smelling like, what is it, disinfectant the whole time. Because it's just like trying to overkill
everything else.
But yeah. Oh my gosh, some crazy. I don't think I had any crazy placement stories. Had a few people like bail out and stuff here and there and fail and things like that.
Oh, I feel like I had some wacky.
Oh yeah.
I had some weird stuff. We had like I had one of my first like at in the cardio resp stuff. He was discharged. So he was in a car crash. He was in a car crash and then got discharged. Like he was okay. Got discharged and then came back in like 3 or 4 days later with type 2 respiratory failure because he'd had a massive hemothorax, which had basically taken over his whole lung. So like basically blood filling up the like capsule lungs, of his lungs. So he just was basically unable to breathe. And so they didn't want to put a drain in, so they just put him on oxygen, which, you know, it was a massive hemothorax. And then I was seeing him for a couple of weeks and really like he just couldn't keep his oxygen up. Like his sats were just dropping all the time. They wanted to discharge him. And then they were really pushing to discharge him, and my educator was like, he cannot go home. He cannot maintain his sats. And they wanted, it was a whole like argument. Anyway, they ended up doing a blood test basically to prove that he was fine to go home. And he was really in like type 2 respiratory failure, like very, very severe. Yeah. So they ended up having to take him into ICU and drainers, like put a ICC in.
Yeah.
Which was like, and then he came back up, and 2 days later he was fine. They drained like I think 2 liters or something.
Oh wow!
It was insane. Like they drained a massive amount.
Crazy.
This poor guy had been like in hospital for 5 weeks for this, and I was like, you could have just put a drain in.
Yeah.
Anyway, wild.
Yeah, it is pretty wild. Eh?
So
that kind of stuff happens. Yeah.
And like we used to get a lot of the dementia rehab that we were seeing in neuro. Which was...
Mate, oh my gosh. I can't even remember where this happened. I went to a dementia ward. I don't even think it was through uni. I think it was even in America for like my health studies. And these two dementia ladies communicating like in different rooms through bird calls. They were like, caw.
That's wild.
Like, we were like, what is that noise? And like the ward lady or whatever, oh, that's just Beatrice. I was just like, what? Yeah, they're just communicating through bird noises.
That's anyway, cute though. It is cute. Very cute. I had a patient in the same afternoon take a swing at me. When I say the same afternoon, like within 10 minutes, take a swing at me and then come on to me.
Wow.
It was pretty wild. And like
Are
me.
they like, no,
No, he was dementia. Really significant dementia.
Yeah.
And in the end, you just get, it's so funny though, like, because I feel like in those kind of situations,
you got to roll with it a little bit, don't you?
Well, I ended up just having to tell him to get back into bed and like yell at him. And so it was just like, get back into bed. And then I had to put the bloody no falls risk thing off. And then go out and tell the nurse what had happened.
Yeah, righto.
But I felt like cruel. I felt cruel because I was like, I feel like I'm locking this grown man up into this bed. But he's just tried to assault me in multiple ways.
Yeah. Do you know, this is probably really bad. This just made me think of one. I had this little old lady who needed to move. And I think I went to her care house or whatever. And obviously she has an advocate or someone telling her that she needs to do physio and move. And so it's really hard as a physio to go someone's place and tell them to do exercise when they don't want to do exercise. Yeah. And I don't think she was verbal either. Made it even more difficult. And she kept swinging at me. But she's this little old lady who slow as anything. And I was just like, you know what? At least you're moving. I was just like, okay, come on, let's go. She would just keep swinging at me, and she just keep doing this, and I'm like, yes, good, let's go, keep swinging. It's just, it was just like, wow, at least you're doing exercise.
That's so good.
But you just gotta find those things.
That's so funny. That's so good. I love that.
I'm like,
Far out.
Yeah. You've got to you problem solve in this job a little bit.
I don't think I've ever been that creative. That's cool. Mate, that's really cool.
I think that's probably the one thing I liked about disability or neuro is you do have to problem solve and try and come up with ways to I don't know, to get what they need functionally out of the task and stuff. Yeah. Like at the moment I'm predominantly seeing mask, but I also see a couple of stroke and amputee patients, and they're always really fun, I think, working on that one-sided weakness and things like that, and trying to get things going and whatnot. It's always very interesting.
That would be really, I didn't do too much. I haven't done too much work in like the neuro space, just like placement and that, which I enjoyed my placement. Yep. My neuro placement was good, and then like my last placement, my elective was like at the Children's Hospital, so I got to do like a little bit of neuro. Oh wow. A little bit of like, I was technically in it was an oncology placement, but we covered neuro and oncology because most of the clients that we would see had like brain tumors. And so they were kind of like, you can't do oncology without doing neuro. But then I ended up seeing a lot of different clients, which was really, really cool. And then because I was like seeing so many of those kind of clients, then they kind of just kept giving me like hemophiliac clients and stuff like that, which was really pretty interesting. So I got to do a lot of like, kind of neuro, oncology, a little bit of mask. Stuff like that.
Because there's so many different specialties of physio. Vestibular, pelvic floor.
Hate vestib,
That's probably, I was going to ask you, what is your worst, like what would you never ever do or refer on for?
I just don't, like if someone comes to me and they say they need like a Hall Pike or something like that, sure.
Mate, I can't even remember how to do that anymore.
It's the bloody, I don't even know if that is the name of it, but I think it's like the barbecue roll or something like that. Is that what the name of it is?
I thought it was just head roll. I don't know.
Well, there's like the whole, you tilt, you go back, you have to drop. And then go. Yeah. I've had to do like a couple of them.
I've got two vestib physios in my clinic, so I'm just like...
I would go straight to them, Yeah,
you go then.
Yeah. No, I don't like
Respect for it, but it's just too many things for me to remember and movements and things like...
I remember the lecture that we did for vestib, and they were like, if you get 2 downbeats in this direction, then they have it in the anterior canal. And if you get 3 downbeats and 1 upbeat in this, it means this. And I was like,
No.
I don't remember any of this.
Yeah. We also have some lovely pelvic floor or women's health physios.
I've worked with a couple,
Yeah. And I, one day, one of their patients came into me, and I was just like, I don't think I can help you. And she was like, something's protruding out of... And I'm like, no, you can... I can't help you with that. I mean... I potentially could, but I'm like, you're definitely going to get more benefit from seeing an actual women's health physio rather than me trying to rumble around trying to help you.
Yeah.
But yeah.
We used to get a couple, like not really in my current clinic, my old clinic. I used to get every now and again, we'd get a couple of referrals for like some women's health. And luckily I worked with 2 women's health physios.
Yep.
Really, really, really passionate about it and really talented.
Yep.
And I did a couple of like mini, I'm going to say like mini sessions with them where they were kind enough to talk me through the basics. And so when those people would come to see me, I felt like I was stumbling through that first session, but I would basically give them like a questionnaire, find out, you know, all of their main complaints and that, and then give them an exercise, and then book them back in with a women's health.
Yeah.
Just so that it was like, because otherwise you're just like not equipped.
No. Well, you know how to potentially activate the pelvic floor and do all that cueing, but realistically,
there's so many
there's
things.
so much other things that come into it and whatnot.
Yeah.
I remember missing a day at placement actually where they did the ultrasound, but for male physio, for male pelvic floor, sorry.
Yeah.
And I was really upset I missed that day because I would have apparently, because I had some male students that were in my, I don't know, that class or whatever with me, and they said they didn't realise that they would have to drop their pants and
that's
have
so funny.
I'm like, oh, that's so awkward. Yeah.
I worked with male physio, like men's health physio. Funniest story I've ever heard.
Yeah.
Ever. This guy was coming in to see my colleague for like just some, like I think it was post prostatectomy or something like that. He was like a few weeks post, was getting checked, making sure like everything was working. So my colleague gets out the ultrasound to check and see how things are going. And he's got a student in with him, so like a uni student in with him, just doing observational placements. And this student is on his like last day of placement. I think he was doing like an allied health or something like that. So he'd been with us for a few weeks. Last day, and while my colleague is using the ultrasound on this client, he just starts squirming around, and my colleague looks up. The student has fainted on top of the patient's face. Because he forgot to eat breakfast because he was running late.
Guy.
And he it just was like really nervous, and just when he was ultrasounding, just went fully fell on top of this patient's face.
Yeah, eat properly.
Yeah. So,
oh my lord, oh my days.
But imagine being in that room, and so then our physio has to come out and be like, get one of the other colleagues and be like, can you please come check on this student? Like, he's just fainted, and I don't really know what to do. Like, it was so funny. So, like, hearing about that, like, later that day when they're like, did you hear what happened to so-and-so? You just fainted on top of a patient. I'm like, what do you mean he fainted on top of a patient?
Yeah.
Like, no, you, like, fainted on top of this guy's head.
Yeah.
So, apparently the wife was in there as well, and she was really confused.
I had one of my classmates, we were talking to an amputee, or just, we had an amputee kind of session with an actual amputee. Yeah. And he started to feel really queasy. Yeah. And just looking at an amputee, and I was like, okay, righto. Yeah. I don't know. But it was just like, okay. And he ended up working in hospital and stuff. I'm like, mate, you're going to see queasier things than someone with, Yeah. So, oh, mate. Oh, fainting.
That's wild. It's always funny.
Yeah.
What, I don't know, what did you love about uni? We've kind of gone off on a little bit of placement tangents, but
my lovely friends. I still have a group that I guess you'd say study friends or whatever that I would click with, I guess, and we meet every month.
That's
we still meet 6-7 years down the line.
That's cute.
We still meet, most of us, every month.
Yeah.
One of my mates in that group's actually gone on to do engineering now, and he was originally wanting to do prosthetics.
Wow.
So he's an absolute brainiac.
Yeah, it would have to be.
I don't know what he's doing now. He's telling me I don't understand him half the time because he's so smart. But yeah, he's doing that. And I got another one that was doing pediatrics. Really went down the pediatric line. She's good, but now And now I think, but then it's crazy to see like my other mate's gone out of physio. She's gone back to doing just a normal kind of job. And another one's also doing disability. So it's just funny to see
where everyone kind of
ended up.
That's interesting. Well, because you actually work with one of the guys I went to uni with.
I do. Yeah.
Shout out to Michael.
Shout out to Michael. Yes, he's a lovely man.
He's so sweet.
He's like the loveliest man.
He's so sweet. I think we started clicking. I think in like probably maybe the end of first year, second year, or something like that. He was a champ though, because he lives in Toowoomba and would travel to Bundy every week,
crazy.
For things, and had me over for dinner a bunch of times, and he was in my honours group. Throwback.
He's such a dad.
He's such a dad, isn't he?
Yeah,
he's so good. Yeah, beautiful man. But
he is a beautiful man.
What
and
about
he's like a Japanese fighter, sword fighting fiend.
I can't remember exactly what it
There's
is.
all these different types, and he's told me before. I'm so sorry, Michael. But yeah, he's pretty cool.
Because he's really good at it. I remember. Oh my god! I remember we were at uni one day, and he was out doing. I can't remember. I'm gonna butcher it, but he was out doing almost like a performance, but not a performance, because I know that's not the right word. But he was doing some moves in the on one of the fields.
Oh, cool.
Or like the patches of grass or whatever, just outside one of the buildings. Really small uni. And I think the security guard ended up coming up to him and being like, not realizing he was a student. You'll have to ask him about it.
Oh, wow.
Yeah.
He definitely gives me Miyagi vibes, off of like Karate Kid.
Yeah, he
gives
is,
me those. No, he's so good.
That's exactly right. He's such a sweetie. So.
No, yeah.
What was your least favourite part of uni? Or things you struggled with? What'd you struggle with in uni?
I just struggled with, because it was the master's program, we were like back to back content. Like when I finished my 2 years, I actually didn't go. Some people went straight into it, straight into work. I actually took 3 months off to just chill out and not use my brain. I actually did landscaping for 3 years with one of my 3 months. 3 months. 3 months.
So 3 is a long time.
Sorry, 3 months with one of my best mates, Dodge from Volley. Yeah, so
shout out to Dodge as
shout out to Dodge. Honestly, if I never met that man, my life would be so much different. I think just in regards to meeting you guys, Rebound, like he's the one who kind of got me more into it. I guess got me more into Interclub and stuff. I don't think I could say got into it too much, because Kevin, my best mate, probably got me into it. But then
shout out to Kev as well.
Shout out to Kev as well. But then he put me up through my uni. So I did, because I was originally in Wynnum. Oh. And then I'd have to travel into UQ, which I don't know if anyone doesn't know Brisbane. That's like 30-40 minutes
good
drive.
Yeah.
And so I stayed with him as a POV uni student. And worked at the volleyball centre.
Nice.
After hours.
That's
getting
sick.
a bit of extra cash and
cool.
stuff. So,
Very
but what's the question? Yeah, it's just the fact that it was so quick. In another instance though, like I'd already done 4 years of uni. Yeah. If it was any longer it would have not been appealing either. So I'm kind of glad it went quick.
Yeah.
I'm thankful that I didn't fail anything that I got kept back. Yeah. Because there was a couple that, you have to wait a whole nother
year. A lot of that's the same with CQ. Like if you fail a subject, you got to wait a whole year to get back in.
And that's a struggle.
It's rough.
That's a struggle. Mate, rough. I don't know. We had one of those. Yeah. Like, you know how you had your whole cohort for so long, and then you had one of those come at the end because they'd failed everything up until that subject. He'd failed like 6 or 7 times.
We had a few of those. So there is a girl. There is a girl that now is a physio.
Yep.
Scary.
You fail that many times.
She started like 2 or 3 years before me.
Yeah.
Before I started.
Yeah.
And then I overtook her, and she graduated last year.
Mate, you should not be a physio.
No. That's terrifying.
Yeah, it's very terrifying.
Crazy.
Like, do they not have an obligation to like be like, this isn't for you?
Well, I think they do. I think they do at a certain point.
Yeah. Oh.
Yeah. I know. Yeah.
It's hard to say.
Yeah.
Tough call, but
crazy.
Props to her, I guess, for sticking it out.
Yeah,
but still,
at what point? At what cost? At what cost to the public?
Cost to the public.
Rough.
But,
See, I don't know. I didn't love my first year of uni just because it was a big transition. Or like first year of physio, I enjoyed the subjects and the content, but the workload was a lot different to my last 2 years of sports science. So that was hectic. But then also like the end of my degree happened with COVID as well. Yeah. So then I loved my last couple of years because it was like I couldn't work, so I didn't really have any distractions, and everything was like just online. So I just had heaps of time to study. Like didn't get a lot of hands-on experience until like I went on placement, but then that was really good because everyone was really understanding of that. So we got like extra time with hands-on stuff, which was pretty good. But I loved that part of uni. Back at uni now, so doing Masters of Exercise and Sports Science, Masters of Exercise and Sport Physio at La Trobe, and that's a lot of work.
How many years is that?
It's 2 years, yeah.
Because I thought you had to do a Master of Mask and then specialise in sport.
No, they do it falls under like almost like an umbrella of it, I believe. Okay. So they do have a Masters of Musculoskeletal Physio. Yeah. But then this is like a separate master's program or separate degree.
Did you look anywhere else? Like did you look for Queensland?
Yeah, I looked at a couple of other courses, and pricing of it was, pricing is insane anyway.
No, I'm never going to pay off my student loans.
I've just accepted that. Yep. But the price of it, yeah.
Living in debt. Yeah, anyways, yep.
So the price of it was just pretty crazy. And then, I just like the La Trobe program just looked really good. Okay. Looked really good in terms of what they can do in terms of like of your placements and that. So, just applied for that. Figured it was always like, I always knew I wanted to go back to uni. I always knew that would be something that I wanted to do. Yeah. But wasn't sure when or exactly what. And then was chatting with one of my old colleagues, and he'd done the program, and he basically, which probably made me a little bit biased towards it as well, because I think he's like the best physio I've ever met. And he kind of just was like, oh, if you're finding something you're really interested in and you want to do it, like you should just do it now if you've got the time to do it. So applied and then got in, and it's hectic.
Yeah, you've started?
Yep. Yeah. So I got to go to Melbourne in about a month to do like a week of like hands-on stuff, and then an exam at the end. And I think I've got 2 more exams to go, and then 2 more assessment pieces to go, and then that one block. But I think I've done 4 or 5 assessments already, so it's a bit.
Is it all research based, or what are you doing assessment
on? Clinical case studies for the most part. So I've done 2 clinical case studies and reflections, and then I've got an exam, like a oral exam on that as well. And then I've done like some research ones as well. So I've had 3 assessment pieces for research.
Mate,
and I've got 1
research.
More to go. I hate it. I've done so many of those fluff subjects that are just like, how do you research?
I hated it.
I hate them.
I hated it in school. We had like this weird statistical one where like it was computer generated, and you had to like, you had like a community almost, and it was all, because it's all like statistical. You're doing make your community do a survey or some shit like that. Yep. And it was just the stupidest subject. It's the stupidest subject. But I understand if you want to go into research and
you need to do it.
You need to be able to do it. But no, it's a silly subject.
It was shit. Yeah. What was your favorite subject at uni?
Oh gosh, what was that noise?
It was beautiful.
Sorry. Favorite subject in uni? I don't even know.
I think you should just keep making noises.
Make weird noises. Yes. Yeah. I always you know what comes to mind is, and it's not my favorite subjects, but like we learnt all the modalities and treatment techniques. Yep. And the fact that they taught us laser and other things, and they were like, you probably shouldn't use this.
Did you get the little clicker pen? Do you see that? Okay.
Click a pen, no.
I don't know. I just remember
like
learning
tens
about it
and all that.
Yeah.
We learnt all that, and
Yep.
they said, you know, evidence-based practice doesn't actually mean
This
that
doesn't work.
This
yeah.
doesn't work.
This doesn't work. But
we
we're
are
gonna teach you
obligated
anyway.
to teach you it,
Yep.
and we're
Yep.
like, what? Why
Yep.
would you teach us it?
Yep.
If it's not evidence-based
If it
practice,
doesn't really work.
it doesn't really work. Anyways, I think it's because there's still clinics out there that use it. I know you've actually mentioned that you still use it.
Yep.
But I mean, yeah, I'm not going to say anything.
Tell us what you really think, Beck. Tell us what you really think.
I had this classmate who, at our last, you know,
This is the Reiki stuff again, isn't it?
Yeah, no, I had this classmate. He's so blunt. He'll just say whatever he wants, and his opinion on laser was freaking hilarious. Anyways, he got really drunk at the end of graduation thing. I don't know if he got an award for anything or something, but he had a drunken speech about how laser was the most non-evidence-based practice, and why the fuck did we need to learn?
Yeah.
And he just went on this absolute rant, and it was just the most funniest thing, and I've still got it on video. But yeah, it's just, yeah, I don't know. I just made, as soon as you said what was your favourite subject.
So your favourite thing was learning
I
all
just
the
think
things that don't
it
work.
was just funny how
It is funny how, like, you can be in a job that is so evidence-based, like
Yes.
evidence-based practice, clinical reasoning, and then also, like, there's so much about it that, like, they don't know how it works. And it's, like,
to
uncertain
be fair,
how it works.
If it works for a patient, who cares?
Use it. Yeah.
Who cares?
Yeah.
Because I think, like, obviously we're going to delve more into manual therapy and evidence-based, you know, exercise prescription and whatnot. Some people don't use manual therapy anymore.
Yeah.
Because there's no evidence for it. But it creates a buy-in.
And that's, I think the other thing, it really does. It does create a buy-in, but there is also certain, like, populations and certain conditions where, like, manual therapy and education, because education, exercise are kind of like the, you know, where physio is really headed.
Yeah.
But exercise and education and manual therapy in combination are more effective.
Yeah.
I think as well, a lot of times people come to the clinic because they want that hands-on therapy.
Yeah.
So, I don't think there's anything wrong with.
Yeah. I appreciate them teaching us, but obviously I don't really. I think I learnt more when I left uni.
Yeah, 100%.
I think I learnt heaps more when I left uni.
100%.
You just learn as you go as well. I think we talked about this, maybe not on the podcast, but more so with, like, clinical reasoning and stuff like that. I feel like you learn that a bit more outside of uni.
100%. Yeah.
I don't know how they really. They try their best.
They try, yeah.
They try.
But
and obviously placements try.
Yeah.
But, yeah.
You can't, I think there's only so much you can really capture until you're actually out practicing and, you know, making mistakes and finding out what works for you and what works for one clinician doesn't work for another, and everybody's got preferences, and if you find something that you're good at, you stick with it, you know, which I think is, probably the best. I don't know.
Yeah, I agree. So, yeah, I think if anyone's listening who's a uni student, I guess, keep trotting on, keep doing it.
Keep doing it.
You know, I honestly think as you get to placements you really tend to find what you might like.
100%, yeah, 100%. I reckon it's a lot, like doing all the theory and that is exhausting, and I found like a lot of stuff didn't feel like it made sense. Like I felt like I was getting a puzzle piece for a puzzle that I couldn't see the picture of, and then when I got to uni, it was like all of a sudden it was like, oh, those extra couple of pieces, now I know what I'm looking at.
Yeah.
But I didn't feel that way until I got to placement, which was hard, because then it was like 2.5 years where you're like, what the fuck am I building?
Yeah,
I don't know what I'm looking at. I've got all these tools in my box, and I don't know what the fuck I'm using them for and but I feel like placement's a big learning curve, steep learning curve, but
yeah,
you do get it. So
you do get it. You will get it, and obviously, difference between hospital and private practice as well. Private practice is its
better.
own.
Yeah.
It is better. I think so. It's better. I'd actually like to get someone on here who thinks
works in
hospital
hospital?
might be better.
Yeah.
I think
That'd be sick.
I hate to say it's easier. Oh gosh, that's
I
probably
don't know
a big
if I would
call.
say it's easier.
I don't know if it's a big.
It's different.
You know what I found funny?
Cushy,
Like I went to, I can't remember if it was MARTA or somewhere else because I did 2 or 3 hospital placements. They were still doing handwritten notes.
Yeah, every single hospital placement I went on, except for the Children's Hospital, was handwritten notes.
Ridiculous.
And you know what the worst thing was? Half the time, you couldn't write one note. If you saw a patient, like, so my neuro placement, you had to see every patient. Because neuro's a lot of evidence about, like, how many times you see a patient. So I would see, what am I telling you that for? I would see a patient like 2 times generally throughout the day. I wasn't allowed to write one note for both sessions. I had to write one note per session, and then I think I was seeing 7 or 8 patients. So it was like, you're doing 16 sets of handwritten bloody notes.
Also, doctors do write terribly.
Doctors write terribly.
Every single doctor, surgeon, wrote absolutely terrible. Like, what the fuck did they do on this person? I don't know what you did.
I love how, like, they're so strict about note writing, like handwritten notes. Nobody follows it, except for probably the physios. Yeah. I felt like I was the only person in any hospital that was, like, blanking out lines when I wasn't writing on them and signing my name at the end.
To be fair, I feel like as students, we were probably made to do it. And we didn't have as many
How's your note-taking these days?
I use a lot of anagrams.
Yeah, same.
Anagrams? Is that
I don't think it's anagrams, but
what is
shorthand?
No. Yeah, shorthand.
Shorthand, yeah.
No, it's anagrams. Anagram? Is that when you, like, have initials or something? Oh, gosh.
No. Someone should write in and tell us what an anagram is. What's an anagram?
Yeah.
I don't know.
I've learnt some, and then but it's always fun reading other people's notes.
Trying to figure out what they are. I like ATOR, like at time of review.
Oh, yeah.
Or sit out of bed in chair. Subic.
Yeah. No.
I like that one.
Yep.
What other ones have you got?
Civic. Half the ones I don't even know.
They're not. Wheelchair, like that's easy. WC, yeah. We should definitely do an episode with just all of our like most random ones that we've come across.
Lumbar, just like it's so quick. Like lumbar spine, LX,
CX, TX. Yeah.
Some of my colleagues' notes are just letters, and I'm like, what does this?
What is this language?
What does this mean? But if it makes it quicker, I guess.
Yeah.
But yeah.
It's always funny.
Yeah. Should we move on to our segment of From the Bench?
From the bench, we should move on.
Should we do a bench? Or will we talk about anything else about uni, I guess?
I feel like we've covered a lot about uni.
I think we have covered a fair bit of uni.
Any questions? Submit.
Yeah, I'd really like to understand if anyone has any of uni stories or
questions or
any opinions about going through physio through uni. That'd be really
and we'll share the good ones.
We will share the good ones. But
the bench.
This is not about that. This is about from the bench. And this is something we introduced last episode, which is a week ago,
It's real time.
Yeah, in real time. And that was going to be,
funny injuries. Or stories or crazy stories.
Yes. And since this is the first one we're doing, we were going to do ourselves what funny injuries
Kick it off.
we
Doesn't have to be sport related.
No, mine are definitely not. Are yours sport related?
I've got some
have
like
you got
sport
any
related. Or any stories?
Have you got any funny not rehab, sorry, injury stories. Yeah, any injuries?
Any injuries? Yeah. I've injured myself a few times.
I've injured myself a few times. Anyways,
do you want to kick us off with one?
I'll kick us off with one. Look, this is funny to me. This is quite funny to me. I played a lot of AFL back in the day. Not a lot actually, probably like 2 or 3 years. Just social, and AFL can be quite physical.
Yeah, it's a
very
intense,
physical sport. I went through a whole game of AFL and no injuries, and I was walking to shake hands with people, and I fully rolled and twisted my ankle on a piece of grass very, very badly. High ankle sprain.
Wow.
And I was like limping off the field. I was like, what did you do? And I was like, I rolled my ankle going to shake someone's hand.
Yep.
And I felt that was just the absolute stupidest thing.
It's the best way to do it.
The stupidest thing.
Best way to do it.
Not dramatic or anything. I just fell to the ground, and I think we had lost too, so it wasn't even like...
Yep.
It wasn't even like, yeah,
Yeah.
kind of thing.
I feel like all the good injuries, they
I
come
think,
out at that time.
this is back when I was young and I hadn't done physio either. And we, as you do after a footy game, you go out drinking.
Yeah.
Yeah. Woke up the next day. Holy crap.
Cankles?
My ankle was enormous. Absolutely. I could not put any pressure on it.
Dear God.
Swollen as anything. All because I was drinking. That's probably something you
Yep.
shouldn't do with an acute... Don't drink with an acute injury, guys.
Yep.
Because it's bad.
It's bad.
It's quite bad. It's harming for your injury. So yeah,
I feel like I see so many people nowadays, like in the clinic, that are like, oh, what was like after it happened, like after the injury happened, what'd you do or whatever? And so many of them like, oh, I don't really remember. I went out drinking. Like, oh, good, okay, great, perfect, love that.
Well, people think it's gonna numb the pain,
and it does, but it
the next
makes
morning
it worse.
Makes it worse.
Yeah, so much worse.
It's so much worse.
See, my funniest injury story, is in a sport injury.
Okay.
I was like exercising kind of, was in like Japan a couple months ago now, and I was riding my bike. So Em and Chris, love them. We decided to get again shout out to Em and Chris. We decided to hire bikes in Kyoto because we wanted to do a lot of touring around the city. And anyway, the guy, you know, do you want insurance on the bikes? He's like, nah, I'm not paying.
Fine. We know how to ride a bike.
I'm not paying an extra $5 for insurance.
Yeah, why would you?
On this damn bike. And so anyway, we're like, I'm not a good bike rider by any means, as I know now. Anyway, I'm riding this bike along the streets of Kyoto, and I think I'm picking up a bit of speed because I feel like I'm going pretty fast. We're not wearing any helmets. And I tried to go up the curb, but like it was like a gutter almost. I don't know why. But like I hit it, you know, like you got to hit it at the right angle to like actually get the tire to go up. I hit it at the wrong angle, and then my tire got like stuck in the gutter, and then I was trying to brake, and like imagine legs flailing, and Em and Chris are behind me, and I can't get this bike to slow down, and I'm panicking. And then I reef the bike up onto the footpath. I go across the footpath. I then am heading at a rock wall, so I try to ditch the bike. So I throw the bike away, but the bike hits the rock wall and flings off.
Yep.
And then I hit the rock wall, and it pushes me, like bounces me backwards off this rock wall. And as I'm like stumbling backwards, so like literally stumbling backwards, I'm about to land flat on my ass, except that right at that point, there was no railing on this gutter, and I fell backwards into a drain, and like full turtle, legs up, can't get out on my back. And all these Japanese people ran from across the street, because it would look like the most ridiculous thing, like someone on a bike and then they just disappear.
Wow.
And yeah, I had so many Japanese people come over, like leaning over the top of me, trying to pull me out of this drain. Are you okay? Are you okay? Are you okay? And I was just like hysterically laughing because I was like, please leave me alone. I want to die. This is the most embarrassing thing that's ever happened to me.
That is pretty embarrassing, actually.
Massive chunk out of my knee. It was so embarrassing. Took a massive chunk out of my knee, like scraped up my arms, and was very, very sore for the rest of the day. We went to the bamboo forest after, and by the time we got there, which was like another like 5 or 6 Ks away, I just wanted to go home. I was like, well, I've already ridden 8 Ks. Take me home.
You didn't break anything or anything though?
I didn't break anything.
Oh,
I was so sore though.
Yeah.
I've not been that sore. I felt like I've been hit by what I imagine getting hit by a bus feels like.
Oh my Lord.
I like just went and laid down basically.
I feel like you hurt your ego more
I
than
hurt my
anything,
ego.
yeah.
My ego was so sad. And Chris and Em, good friends. They took photos.
I just imagine you like a cockroach. Like,
literally. That's exactly what it was. That's exactly what it was. I will show you the photos that they took of me in the gutter trying to get up.
Yeah, we should post that on Instagram.
Yeah, we'll post that. We'll post that on the Insta. It's a good one.
Oh,
yeah.
I love it. I love it.
Any more?
Mate. I mean, falls I've had.
Falls?
Nothing where I've actually fully broken myself. Well, I mean, there was an incident where I got another. Ankles are terrible. My ankles are shite.
Ankles are.
I think with
ankles
volleyball,
are
indoor particularly, I don't know if you know, but that's the most common injury in volleyball is ankles. And my ankles are, I've got one that's chronically stiff.
Yep.
And the other is just lax as anything.
you need to mix them
I'm
together.
just a bit mixed, yeah. The one that's lax always tends to roll. So I was back from pro over in Sweden for, I guess you would call it their summer vacation or season break. And I was back at work for disability, and I had a client that I used to see but wasn't seeing because I'd changed over and whatnot. But I was back doing casual work, and I was seeing this client, and after I'd finished a whole day of work there, she was really excited to see me. She's a younger client, and she wanted to play balloon kippy-uppy. Now, if you don't know what balloon kippy-uppy is, it's a very serious game. You've got to essentially keep the balloon off the ground, and you each have turns, okay?
What are the rules in terms of, like, can you hit it down or...
No, you have to hit it up. You have to hit it up.
But
or
away
sideways.
from the person,
or
right?
Sideways, yes. Or you can just let it, like what I tend to do, is just let it go close to the floor and then just do a little tap kind of thing. Yeah. She'd done a big freaking yeet kind of one, and I was looking up trying to get it, and I think... she was underneath me, but I'm so tall, I can't see her. Yeah. And I went to jump to get it and do a spike and be like, ha-ha, huzzah. Landed on her. Yeah. Like, fully landed on her. Took her out. And then I rolled so badly. Ankle was gone. Yeah. But it, I was like, oh, I'm fine. I didn't want her to feel bad. Yeah. But I was not fine. I was not fine. And my colleagues were laughing at me and everything because they knew that I have to go back and play another season. And they're like, and you did that playing balloon kippy-uppy. I'm like, I don't know how I'm going to tell my coach that, no, it wasn't, it wasn't that I wasn't playing an extreme sport or anything, because he was always like, he'd always be like, don't go do skiing, don't go, don't go do those things because you don't want to hurt yourself or you're getting paid to play. Yeah. So I was like, I don't know how I'm going to tell my coach. So
kippy-uppy.
Just playing kippy-uppy with
you weren't doing anything extreme.
Yeah, and the annoying thing is she wasn't even my patient. Like, I didn't have to do that. I didn't have to play with her. I was just being kind. Yeah. And as I am, kind of thing. But it was quite funny.
That's pretty good.
That was ankles are terrible.
Ankles are not good for you.
Ankles are absolutely terrible. Yeah. But yeah.
See, I got one bad ankle, one bad knee, bad shoulder. But they're like zigzaggy.
Gets worse as you get older. Great. Honestly, yeah.
How good.
Yeah. My dad has had a lot of falls. Has your parents, like, as you get older, I feel like
my dad like tripped over once because my dog pulled him over. It was the scariest thing I've ever seen. Oh yeah. Because like I feel like my parents never fall.
Oh yes.
And so then like my parents aren't. They're not old by any means, but like it was terrifying. And then like immediately physio brain was just like, oh my god, is your hip broken? Yeah. But I was like, my dad's like 50. Probably not. But it was really like scary.
Dude, if you break your hip, you're gone.
Yeah.
Yeah. You're fucked. My sister, when she was younger, had the most bizarre injuries. She's been kicked in the face by a horse.
Jeez Louise.
And then everything happens to the face. She got hit in the head by a cricket bat. Like, one of our cousins was like really swinging up to go, and she was too close to the wicket keeper, and she got boom, like got whacked in the face.
That's awful.
And then the most one that I remember, because I was quite young and she's my older sister, we had a dog, and we used to have a basketball net out the front, and all the neighbour kids would used to come and we'd shoot hoops and stuff like that. And the neighbour kids would bring another dog, and so our dogs would run around the yard and stuff. Anyways, they were zooming around the yard, and they were coming back around, and my sister was standing there. One of them missed my sister. The other one fully took her out, and she went like, and she fell, and she broke her wrist.
Oh my god!
From this dog just yeeting her off the cement. It was hilarious.
The way that you said that was so good.
But you can just imagine it, right? You're just like, like this. So she was like that. Anyways, I feel like there was a few different injuries that we talked about. Do you have any others?
Are the good ones?
Are the good ones? Yeah.
like funny ones or?
I don't know. Well, it is from the bench,
funny,
and it was going to be funny or crazy or anything.
I broke my wrist.
Yep.
When I was in year 12. It was the first time I ever broke anything, and the only time I've ever broken a bone. And I was in acro. So embarrassing. I'm not good at acro at all. And
what is it?
Acrobatics.
Oh, sorry.
Yes.
Sorry, I'm not bougie. I don't know what acro is.
Acro.
Acrobatics,
So we're doing acrobatics, which, like, I'm not flexible.
Fair.
At all. And I have good balance, but not that good balance. Anyway, I remember you had to be you and a partner, basically. You chose your partner. You'd design your own routine, perform it, and then basically get graded on it. And the guy that I was working with was really, really tall, lovely guy, but not super coordinated with acro either. And we'd kind of designed our routine. Anyway, there was one part of it where I had to stand on his shoulders. So he's like 6'2" maybe. Had to, stand on his shoulders, and honestly, I don't remember what we were going to do after that point, but basically we decided that because our assessment was like 2 weeks later that we should practice without the safety mats for the first time, because you had to do it without the safety mats. Anyway, and so I was standing on his shoulders, and I started to fall forwards. And so he then tried to correct me by moving my legs, and he ended up lifting me off of him and kind of throwing me forwards, and then moved out the way. And I basically went forwards and then backwards and tried to catch myself, and I ended up catching my hand basically down like that. Anyway, my whole arm went numb, and I got up off the ground, and he was like, are you okay? Like, I'm so sorry, I didn't mean to drop you, kind of thing. And I was like, that's okay. Like, that's okay. It's all good. Everything's fine. It's all good. And then he was like, everyone came running over because, like, they heard a thump because I'd just fallen into the gym floor. And I was like, oh no, I'm fine. Everything's fine. And then about like 3 or 4 minutes later, I was talking, I like went up to one of the girls in my class, and I was like, my arm is still numb. Like, it's numb, and I don't know what is going on with it. This girl, who's now a physio, grabbed my arm and shook it and was like, does it hurt when I do this? And immediately I started bawling my eyes out because I had a broken wrist and I could suddenly feel it. And I'm bawling my eyes out, and then everybody comes back over because they're like, what the hell's going on? Like, you fell and you were fine. Anyway, failed. D. Was not allowed to. Well, no exceptions. Failed acro.
That's so annoying.
Yeah. So I got an A in volleyball, and then a D in acro, and then C overall.
But what about the commitment? Surely they'd, oh my gosh.
Yeah, no, doesn't count for nothing because I couldn't perform.
What a way. Try and perform for you with this freaking limp wrist. What the fuck? That would have been awesome. Just like, just trying to do.
I should have done it. I should have just done it. I should have just committed to the bit.
Oh, gosh. No.
Wow. But that was, I joined the netball team 2 weeks before that, so I was pretty glad that I broke my wrist because then I didn't have to play netball.
What?
I hate netball. I was sucking it.
Why did you join the team?
Because my friend made me. She told me that I had to join it because she was going to be on the team. Right?
Peer pressure.
But guess who sucks and got put in like Div 4 and my friend made Div A.
You didn't play together?
I didn't play together.
I would have been like, peace out.
Yeah.
See ya.
So I broke my wrist and I was like, can't play. Shame.
Oh my gosh, that's freaking hilarious. I'm just imagining you.
It was pretty painful.
This.
Yeah, it was pretty like, and then I just remember being like, oh my God. And then my mum, this is like the worst part. So I'm in year 12 when this happened. I don't know if this is the worst part, but it's not a good part. My mum...
It's just going to make your mum in a bad picture.
yeah, it is. Right. But it's the truth. It's what happened. Yeah. My mum... I was like in the office. I remember I was like in the office with like holding my hand, my wrist with like an ice pack on it, like being like, this is burning. And I'm waiting there for like an hour and a half for my mum to come. My mum lived like 15 minutes away. Anyway, so mum like walks in and I'm crying because I am hurting.
Yeah.
And mum walks in and she was like, oh, you're actually injured. Oh, sorry. Like, and then she was like, we better go to the hospital, like, because, you know, blah,
Yeah,
blah.
yeah.
And then she was like, oh, they didn't call an ambulance? No, they didn't call an ambulance. She was like, oh, okay, have you had any Panadol? No, I haven't had any Panadol. I was like, what took you an hour and a half? Like, I have been here waiting for you. Like, they told you, they spoke to you immediately after. She was like, well, I didn't realize that it, like, was actually hurting. So I was, like, in bed. So I got up, I got ready, I got dressed, I did my hair and my makeup, and then I went to the shops. And then I figured I'd pick you up on the way back.
Mum.
And I was like, okay. So I did it in first period. I think I ended up went to the hospital and then ended up getting back to my car at like 5 p.m. or something like that.
Yeah, yeah.
It's pretty fucked, eh?
Oh, mother of the year.
She felt pretty bad, and I guarantee she's never hit me so many times in the wrist with like opening cupboard doors after that point. It was like every day she like opened a cupboard door into my arm, and I was like,
It's broken.
it's broken. It hurts. She's like,
just
I'm sorry.
checking.
I'm sorry.
She's
I'm
just
sorry.
checking.
And I was
She
like,
didn't
I
believe
swear
you.
this has never happened before.
She never
I
believed
swear
you.
you've never hit a cupboard door into my arm before. But
Isn't that the go though when you break something and or hurt
you hurt something, you
and you
always
just keep
hit it.
hitting it.
Always hit it.
Yeah, no, that'd be right.
It's awful.
Yeah.
So.
Oh, that was a good one.
I feel
Yeah.
like we've done good.
I think that was a successful first segment of From the Bench.
From the bench.
Or first
Forgot what
round
it
of
was
it or
called
whatever.
again.
Yeah, From the Bench. Yeah,
From the bench.
And so we want people to DM us. We want people to email in their funny
Send us
injury
the
stories.
funniest stories you have.
Please. I want some crazy wacky ones. I really do.
I feel like we should then print them out and like just chat to each other about them.
Oh yeah,
That'd be good.
100%.
Maybe not print
Maybe
them
even
out.
reenact them. I don't know.
Oh,
but
that's
yeah,
good.
I mean,
We'll reenact the good ones. So.
I think you should reenact the cockroach looking on the.
We'll upload the photo. We'll upload the photo.
Yes.
It was pretty embarrassing.
Yeah, it sounds pretty
good.
embarrassing.
True friends
yes.
like capture those moments for you.
Because
I knew they knew that I would want to look back on that. That's the good thing.
They also, the funny thing is they're not like, oh, are you okay? No, let's fucking videotape this that you memorize.
I know that I'm not okay.
That you just
Emotionally.
keep reliving it.
Emotionally not okay.
Emotional damage.
That's fucking good.
I love it.
All right.
Well, we'll finish it there
Cool.
for the night or for the day. Anyways, so
See you later.
thanks, bench warmers.
Woo.
Catch up. Woo.